today we have a very pretty lady with us. She is aging gracefully and she has come to us for doing the Botox. So what I'll be doing in her is standard Botox, in which we do the Botox for the forehead, we do the Botox for the glabella, and we do the Botox for the crossfeed. I'll explain you one by one what all these things are. So coming to the first and the most commonly done area for the Botox, that is the Botox for the forehead. So if you come and see over here, see, when she is not doing anything, when she is at rest, she is having these fine lines over her forehead, and when she animates or when she raises her eyebrows, these lines, they become deep. Okay, so she is having these lines even when she is not doing any movement of the eyebrows. So these lines are already static lines. Okay, so if she had done Botox regularly, say from the age of 30 or so, then these lines, you can delay the formation of these lines. Now these lines have already formed, so what Botox will do now is it will prevent these lines from deepening. Okay, so can you raise your brows for us? See, this is the dynamic line, and just relax now. So the line which is present over there is now the static line. Okay, so what Botox will do is Botox will prevent the formation of the dynamic lines. Okay, so how we mark for this is we usually decide the peak of the brow and say about a centimeter above that. Okay, can you raise your brows? Okay, so these are the lines, and then we design our injection points symmetrically. Now we will come down to the second commonly done area, which is the glabella, or the anger lines, or the 11s, what we call. So why are they called 11s? Can you just round for us? See, she forms an 11 over here. Okay, so this is a dynamic line. Okay, relax. Luckily she doesn't have any static line in this area, so we do the markings for this area. Now coming to the third commonly done area, that is the smile lines or the crossfeed. Can you squish your eyes? Okay, so these wrinkles which are formed over here, they are just like the feet of a crow, so that's why we call them the crossfeed. This is what the points of injection for the standard forehead Botox or the upper face Botox are. Okay, so now when we do the Botox in these areas, the muscle over here is going to get paralyzed, the muscle over here is going to get paralyzed, the muscle over here is still active. So what Botox does is it gives you a natural lift to the eyebrows as well, apart from cleaning the wrinkles off. Okay, so come, let's go on to the procedure. We have done injecting it. She didn't have any numbing cream on. Did you have any pain during the procedure? No. So it is a very fine needle that we use for the procedure. So there is a little bit of a stinging sensation. That's it. There is no pain per se. It is a easily tolerable procedure. The effects, they start showing from the 3rd day onwards, and they continue to build up to 10 days. So usually we call all our patients between 10 to 14 days for a touch-up if required, and the effect, it starts wearing off from 3rd month onwards, and usually most of them, they come for a touch-up between 5 to 6 months. You have to keep on doing it every 5 to 6 months, and the effect, it builds up slightly, but it is better to get it done every 6 monthly at the most. Thank you.